So Morpheus Body is a radiofrequency device with microneedling. What's unique about the body from the face is we use a different handpiece, but we also use different pins. So the Morpheus face is a 24 pin. The Morpheus Body is a 40 pin. What makes this great is that we're able to cover a much larger surface area. InMode recently upgraded their body handpiece to a 3D device. What's unique about it now is that the 40 pins, they don't all fire at once. The internal pins fire first, then the surrounding pins, and then the external pins. Why this is important is that when it's penetrating the tissue, you want the tissue to be hotter at the core than externally, and so the temperature is equal kind of at the end of the treatment, that it's not real hot on the ends at the end of the treatment. So with this advancement in the handpiece, we've been getting wonderful treatments. We've really been getting wonderful treatments the whole time. On the body, depending on which area, if it's appropriate for the patient, we can push the pins as deep as 7 millimeters, and then the radio frequency is able to radiate out about 1 more millimeter. One thing that we do utilize with our Morpheus Body treatments is a tumescence infusion. When we first brought on this piece of equipment about 2 years ago, we noticed that some patients were having a little more difficulty with pain control, even with external numbing and our Pronox analgesia. So Pronox analgesia, it is patient assisted. It's 1 part nitrous, 1 part oxygen, and patients take inhalations through the tubing. Some patients did very well, but we had a large number of patients that required a little bit more anesthesia, analgesia. So I went ahead and got trained on tumescence infusion. And so essentially what that is, and we utilize this during our body type procedure, we add lidocaine to a bag of IV fluids. I pull it up into big 20 cc syringes, and then I use what's called a mesoram needle, and it can have anywhere from 3 to like 11 different needles on the tip. And I'm able to infuse that lidocaine that's diluted in the IV fluids throughout the area. So let's say we're treating an abdomen, I would infuse the lidocaine through the full surface area, even a little bit further, just to make sure we're treating all the margins of our full surface area. And this has provided great relief for our patients. So if you are interested in the Morpheus Body, I would recommend looking for a physician-owned and operated medical spa, and likely one that does a tumescence infusion for body prior to the procedure. This treatment does last lifelong, but we continue to age, so there will be yearly upkeep. So we usually recommend doing the series and then maybe keeping up with the treatment on your birth month every year, just to make sure that you're adequately keeping up with the treatment and maintaining the results.